And of course, the city still recovering from that devastating explosion. Over 170 people killed, thousands more injured. Hospitals, of course, have been overwhelmed as doctors and nurses work overtime, tending to those who are caught in the blast zone and now to those who have also been injured during the ongoing protests. I'm now joined by Dr. Rami Raad. He's the urology chief resident at Lebanese American University Medical Center at Risk Hospital in Beirut. Dr. Raad, thank you so much for giving us your time today.
Hi, Angie. How are you? Good evening.
Well, tell me what the situation is like right now inside your hospital. We know that things have been extremely difficult since that explosion.
Exactly, Angie. Things have been pretty much hectic. It's been a hectic year for Lebanon all over. So to more shed light on the situation is divided into two big pieces. First of all, what happened after the explosion on August 4th. So this deadly explosion that killed more than 200 people and injured more than 6,000 people all over Beirut. The situation that we have and we currently are suffering from is that 3 of the major hospitals in Beirut have been completely demolished and broken down. So the influx of patients is centralized basically into 2 or 3 hospital university in Beirut. And for that, the number of patients that we've been seeing have been increasingly worrisome. Nonetheless, the fact that Lebanon has been facing an economic meltdown, the government have been not so helpful whatsoever in dealing with the situation, and the number of patients that we've been seeing have been increasingly worrisome. We've seen that on the night of the explosion, more than 600 patients, and we operated more than 70 emergency situation patients in our hospital at LUMCRH.
Yeah, it's, unbelievable. And you were dealing with that. Prior to that, of course, you were dealing with and you continue to deal with a pandemic. And then those that have come who have been injured over the protests that have been taking place. Talk to me about also, I guess, the mood, the sense there right now as we know that you guys you and your team are working around the clock to help people. But there is so much political frustration in Beirut right now.
Exactly, Angie. So after the big explosion on August 4th, there was a march and a protest on the Saturday following the explosion. And there was a fear and there was a sense of anger and repression that the population have never seen before. And during this protest, actually, peaceful protesters have been shot down with live ammunition and live rubber bullets and pellets at a short distance. People have lost their eyes. People have been shot at the torso, people have been shot at their heart, people have been shot on their legs, things that we have never seen before in Lebanon. This kind of repression and oppression that the Lebanese people have been suffering from is becoming increasingly worrisome. And we've been asking the international community to shed some light into the situation that we've been facing. It's totally unacceptable in Lebanon that peaceful protesters, out of their anger, out of their fear for their future, for their diseased and killed daughters and children and elderly, have been marching peacefully and have been shot at by governmental forces. And this is something that we've never seen before.
Dr. Raad, you said in speaking with one of our producers that the blast and the protests have set the city back 30 to 40 years in terms of development. What do you want? And you talked about the international community. What needs to be done? What help is it that the Lebanese people need here? What do you want Canadians to know?
So as a Canadian citizen myself, and as a Canadian Lebanese doctor working in the hospital right now, I can tell you that Lebanese hospital and the Lebanese population is in desperate need for any help from the international community. Hospitals need equipment. Hospital needs medication. More than 300,000 people, more than 300,000 Lebanese have been set on the streets because their houses have been broken down. We've been able to provide basic needs, basic food and basic shelter, but the city needs total reconstruction. And for that, we ask the international community for their help on 2 big phases. The first one is trying to help us regain our infrastructure and regain our basic needs. And the other one in helping to take down or change the governmental forces that have been set in place for more than 15 years. And for that, there are 2 phases for this situation, one from the humanitarian point of view and the other one is a political one. So The Lebanese people are basically on a deadlock right now,
Yeah.
and they're literally on their knees. They're asking for any help in any of those faces.
We are hearing you, and we will continue to have your voices heard and have these conversations. Dr. Rami Raad, thank you so much for giving us your time. We wish you and your team well, and you're certainly all in our thoughts. Thank you for this.
Thank you. Thank you, Angie.
You're welcome.